Hi guys, my name is Dr. Michael Hyman. I practice urology here in Encino, which is a suburb of Los Angeles, and I'm what has been designated as a center of excellence for UroLift. That just means I've done several hundred, so I have a lot of experience with it. And today I just want to talk to you about drugs versus UroLift. It may seem kind of aggressive, but in truth, I think we've come to a time in our sort of history of treating this condition that we now have a procedure where honestly the benefits outweigh the risks and negative factors when it comes to comparing this with medication. All the medication for prostate enlargement conditions like Flomax or Rapaflo or uroxetrol, these are called alpha blockers, or Proscar and Avodart, these are called 5-alpha reductase inhibitors. These are all fancy terms, but the sort of simplification is that in the second case, the 5-alpha reductase inhibitors like Proscar and Avodart, those drugs are reducing your active testosterone, known as dihydrotestosterone, and so they're going to have an effect on your sex drive almost assuredly. They may make you feel more tired. You may not have that same oomph as you did when your testosterone levels were all the way up. And then as far as the other drugs, the alpha blockers like Flomax and Rapaflo and uroxetrol, these drugs also, they can make you lightheaded when you stand up quickly. They can make you a little bit sleepy during the day. Some people complain of lethargy. They can give you a stuffy nose. They will often result in a loss of semen or certainly a reduction in semen, which for some men is very bothersome. Interestingly, those drugs, the alpha blockers, can cause a problem called floppy iris syndrome, which is a condition that ultimately makes it much more complicated for ophthalmologists to fix cataracts if you ever develop them. So you may be thinking, I'll just stop the drug if I develop a cataract, but it's kind of a cumulative effect, I'm told, from my ophthalmology colleagues, and they're always very grateful when we use something like UroLift so that they can then get off those drugs. UroLift is just one of the very, very rare treatments that doesn't have side effects. It really doesn't. It's extremely rare for anyone to have a side effect after this procedure. So I would really strongly encourage you to think about it. Feel free to reach out. I'm at DrHyman, Dr. Hyman at drhyman.net. Take care.